My name is Dr. Sunita Dodani, and I'm an associate professor at the University of Florida, Jacksonville, in the Division of Cardiology, Department of Internal Medicine. My major work is on cardiovascular disease in South Asians in general, but South Asian Indians in particular. We have done a lot of work on South Asians, particularly within heart disease. The main one is lipids, cholesterols, and the problems of cholesterol issues in South Asian. So it is a pleasure to be here today.
Thank you so much. And what is the issue? I know we hear about heart disease, cholesterol. What is the problem in our community?
Okay, so here we are now. I mean, if you look in general, let's first talk about why we are talking about heart disease. First of all, right? So if you look at the overall figures worldwide, heart disease is number one killer. Not just the deaths, but even the disease morbidity, the disability is with heart disease, and second one is a stroke. So it's a huge problem. So this is in general. If you look at some of the data, from last decade, the numbers have gone down. Mm-hmm. I mean, that is for sure. The numbers have gone down, that heart disease has gone down, but it is still number one. Why are we talking about South Asians? South Asians, if you look at different communities, ethnic minorities, particularly when you're talking from the perspective of South Asians in the U.S., they have a very high risk of of heart disease. Mm-hmm. So that is one of the reasons, and it's hidden. You know why? Because here, when we see patients in our clinics, and I see South Asian, he comes in, and then he or she, they will first tell me, "Oh, I will not have a heart disease. I'm not obese." And I'm like thin, and I don't have these issues. We don't eat junk food. But I think that is something such a, it's a disbelief because the problems that South Asians have are absolutely different from other populations.
I personally feel, doctor, that we need to shake up the community, and
Absolutely.
what Dr. Naveen Mehrotra is doing day in and day out.
Absolutely.
We need to shake them up, exercise. They have another initiative which doctor has been doing, and I think we should wake up.
Absolutely. This is the time. If not now,
why die young? Why?
And I'm so happy to see, Kulji, that you have, after telling you so many
Thank you,
years
sir.
and years, you need to wake up, Kulji, and you have done that. And I'm so proud of you.
I need to do more. And I think everybody should do it. Means we want everybody to live longer and live healthier.
Absolutely, we have only one life, so why not to be healthy, right?
Yes, doctor. Yes. I feel so. People in our community, I think you should tell them. Yes. You guys are not just wasting your time. You're spending hours and hours of hard work. Look at Dr. Naveen Mehta.
Yes.
You think he has time to do all this?
Yes.
He's doing this event, Sangeet Sandhya. You think unko aur koi kaam nahi hai?
I totally agree with you.
And the purpose behind the event is to raise that awareness.
Awareness, yes.
And
yes.
About this, I guess we call it a silent killer. Is that right?
Yes. And that is why I said, when a South Asian walks to our clinic, you will say, I will not get it. And we consider ourselves, in general, if you look at from other populations' point of view, obesity is not a major issue. It is increasing now, but it doesn't appear.
That cholesterol and
yes, there are other
triglycerides.
The culprits are, we have high cholesterol.
Too much of daru.
Little daru is good, but when you reach that a little,
too much of pakoras and samosas.
That is a killer, Kuljiji. That's a killer. The fried. We always blame Americans that they eat a lot of cheese. At least cheese gives you some calcium too, because it's made of milk. The fat that we use, the fried stuff, pakoras and samosas and all those fried yummy stuff, I love it myself. But that goes straight into our arteries.
Absolutely.